Welcome to the ICU Podcast, where we explore the vestibular experience through conversations between patients and the health professionals who care for them.
During this podcast, we invite patients to share their stories and healthcare professionals to ask questions so they are equipped to better care for and truly see the invisible challenges faced by their patients. I'm Kimberly Warner.
And I'm Cynthia Ryan. And we are your hosts on this journey of discovery.
Welcome, everyone, to the ICU Podcast. We are really excited to have our guest with us today. We actually have one of our Life Rebalance Chronicles favorites. They're all favorites, but Lynn is with us today, so I'm eager to jump in. Today, we are going to talk about silence. The silence that happens when you lose your hearing. Whether it comes on all of a sudden or gradually, losing your hearing is definitely a life changer. It starts when you have to ask your friends and family to repeat what they just said, and then eventually you just stop asking, and you begin to feel separate, apart, not included in the conversation, isolated. Although there is no cure for hearing loss, fortunately, there are very effective tools and treatments that can help people remain engaged with the hearing world around them. Lynn, as I mentioned before, is with us today, and her life became unbalanced in 2015. She had been feeling a little bit off, and then out of the blue woke up with imbalance and loud tinnitus, which is ringing in your ear. Actually, for her, it was her right ear. So as days passed, her symptoms continued to get worse. And then 5 months and 4 doctors later, she was diagnosed with Autoimmune Inner Ear Disease and Bilateral Vestibular Hypofunction. Her symptoms include bilateral profound deafness, tinnitus, oscillopsia, which is jumping vision, and imbalance. Lynn says that if she had been given the correct diagnosis in the beginning, there might have been a chance to save her hearing. Lynn is a VeDA Ambassador and co-leader of a support group for vestibular patients with hearing loss. We are so happy to have you with us, Lynn.
Glad to be here.
Welcome, Lynn. Good to see you again.
Mm-hmm.
I am excited to announce and introduce our other guest, Dr. Molly Schmiel, who is a clinical audiologist in the head and neck section of the Integrated Surgical Institute at the Cleveland Clinic. She's also an adjunct professor for the Northeast Ohio AIED, or Audiology Consortium. Dr. Schmiel specializes in diagnostics and auditory implantable devices. For those of you who don't know what that means, that term, it refers to things like cochlear implants, which we're going to talk about today. She also participates in clinical research related to implantable devices. And in her career, she's led and participated in several initiatives focused on clinical quality control. She's a published author and invited national and international presenter. Dr. Schmiel is currently a participant of the American Cochlear Implant Alliance. Welcome so much, Dr. Schmiel.
Thank you. Thank you so much for having me. I'm excited to be here.
So let's just jump in like we usually do and hear from the patient. Lynn, let's hear a little bit about your life before hearing loss.
Well, I was an award-winning high school biology teacher. I had a 25-year teaching career, biology. I was very outgoing, a social butterfly. I would say I was opinionated, meaning that I didn't hold back if I had something to say. I loved going to the movies, the theater, church. I felt like I wouldn't say I love gossip, but you know how you feel like you just want to know what was going on. Like I felt like I couldn't miss anything. I was just a very independent person. Things that I wanted to do, I would just drive myself. But I would say that I was just very outgoing, social butterfly. in that I was a conversation starter.
Mm.
I didn't mind going up to strangers, smiling, and starting a conversation with people. My life was full, and I was very happy and joyful. I thought this is pretty good, this life. Even though I was thinking about my job was getting a little bit stressful, and I was thinking about maybe retiring early. It came in my head, maybe I'll retire in about a year. So that was like before the hearing loss.
Okay. Wow, what a colorful picture you just painted of your life beforehand. I wish I had been one of those people that bumped into you on the street.
Well,
Yeah.
let me ask you. So we know, Lynn, that as part of your vestibular condition, you lost your hearing, and I'm guessing that at some point you visited an audiologist. So I wanted to ask Dr. Schmiel, what is the role of an audiologist in supporting people with hearing loss?
Yeah, so the role of the audiologist can really take a lot of different forms, and that can involve either diagnosis and management of vestibular imbalance disorders or of hearing loss and management of their devices once we've diagnosed a hearing loss. I think pretty commonly we see patients first when they come in identifying that there's been a problem, maybe a change in hearing. And so we'll do a diagnostic workup of the auditory system and try to figure out what type of hearing loss is it, maybe how long has it been there, and how significant is it. We'll do an audiogram, which is the hearing test done in the booth, and that'll give us some information. But I love all of the things that Lynn just told us about what her life looked like and how active her lifestyle was. I think those are the things that, despite what the diagnostic test shows, is really important for an audiologist to know, so that once we've diagnosed hearing loss or other types of disorders, we can start to help manage and treat those by recommending a device. And some of those lifestyle factors are what are important for us to know to help pick the right treatment for a patient.
And I'm imagining, I'm going to just guess, Lynn, that one of the hardest parts of losing your hearing was the big lifestyle shift. But let me hear from you what you would say was the hardest part.
Yes, it changes you. And that's saying it lightly. But the hardest part for me, there's a lot of things you have to let go. And the hardest part was letting go of the pieces that I thought identified who I was, and letting go and accepting the new way to express who I am. And also it was difficult getting used to the silence and sitting in silence. But I think a lot of the hardest part too is to embrace the fear that comes with it. Oh, I'm losing my hearing. Well, how am I going to do this? How am I going to do that? How am I still going to be Lynn? And accepting that it's okay not to know that, and moving forward. But the hardest part is letting go of the old you and sitting in that silence.
Lynn, can I ask you, did your hearing loss come all of a sudden, or was it gradual?
Both. My hearing loss in one ear started spontaneously, almost overnight, which caused me to go to the ENT. But at the same time, I was also experiencing the vestibular symptoms of the imbalance, the vertigo, the tinnitus. I had everything. I couldn't walk. So, but the main thing for me was to concentrate what was happening with my hearing, because I'm like, what am I going to do if I can't hear? So I lost my right ear. It started, I think I went down to maybe 40 or 30%. Very recognition And over in the course of 2 to 3 weeks, it went down to like 22, maybe 18. So I was profoundly deaf overnight in my right ear. Now, because I'm having all these symptoms, it took maybe a year, 6 months to a year for them to kind of figure out, we don't know what's going on. Let me start you on this immune suppressant, maybe. Anyway, with that, they told me that it's possible that I will be losing the other ear. So they put me on the immunosuppressant. So it actually took me maybe 5 to 6 years to lose total hearing in my left also. So I became bilaterally profoundly deaf 6 years after the initial diagnosis of me losing my right ear.
And of course, this is just hearing loss for you is just one of your many symptoms associated with your vestibular problems, right?
Yes.
And it sounds like for you, it was one of the more impactful ones. Is that right?
Yes. That and the inability to walk and the eye jumping, all three of those symptoms were very devastating.
Mm-hmm.
Because they affected my mobility and my communication and so.
Yeah. Dr. Schmiel, is that, do you deal with hearing loss that comes on suddenly and hearing loss that is gradual differently? Is one question. I have a follow-up question, but I'll let you answer that first.
Yeah, I think with respect to treatment, we do look at them a little bit differently. I tend to find patients also experience those very differently, and patients who have more gradual hearing loss tend to take much longer to come in and seek treatment before they arrive at our door. It could be 7-10 years before they're actually seeking out a treatment. I think it happens so slowly. People don't always realize, maybe how significant the hearing loss has gotten before they're ready to come in. Whereas with sudden hearing losses, kind of like Lynn described, I feel like there can be much more of a trauma reaction to that because you had something yesterday that you don't have today. And so I find those patients, especially in those initial couple months, might be a little more prone to coming in and seeking treatment more quickly. In cases of things like autoimmune hearing loss, where we are worried about it affecting the other ear, we may also look at the treatment a little bit differently and think it's more urgent to get that ear that we've lost up and running with something like a hearing aid or a cochlear implant in sort of anticipation that maybe that could happen on the other side as well.
Interesting. So clearly there's a lot of frustration with hearing loss. Patients feel very frustrated, and there's no cure, so to speak, for hearing loss right now. How do you counsel new patients who may be feeling frustrated and depressed that you can't, quote, fix their hearing?
Mm-hmm. That's tough. It's a really tough discussion to have. I think, as someone who specializes in cochlear implants, by the time patients reach us, they're usually pretty desperate for a solution. They've gone a long time maybe with this hearing loss, and they're coming in to talk about a device that requires a surgery, which is a big commitment on the patient's part, on their family's part. So it can certainly be disappointing when we tell them it's not like a light switch we turn on and you're going to immediately understand conversation that day. So I think that counseling takes a lot of work in terms of having patients understand realistic expectations and what something like an implant or even a hearing aid can give them back. I like to focus a lot on some of those lifestyle factors, focus on how the hearing loss is impacting their quality of life, and then try to guide the discussion to how we expect the devices can give them back some of those things that they're missing. But it certainly, I think, is a disappointment. I try to set expectations actually relatively low with things like cochlear implants, because what I don't want is that we go through a surgery and then have them feel like I overpromised and underdelivered on something. So I do tend to set the expectations kind of low and realistic in hopes that we can provide better quality of life and give them back things like speech understanding.
Lynn, what were your expectations like? Were they managed? Do you remember having an audiologist sort of level set those for you?
No, I did not have a relationship with my audiologist like that at all. More my ENT, the surgeon who actually implanted my cochlear implant. I had a relationship with. He was the one that diagnosed me with AIED, Autoimmune Inner Ear Disease. So he literally walked me. The first day I walked into his office, he went, "I know exactly what you have." So he was very candid, and he told me that day, "You'll probably go deaf." He did not sugarcoat it for me. And he told me, "Don't worry though, we have a treatment for it. It's not really a treatment," but he was already telling me about the cochlear implant. So to believe it or not, I knew from prior to even going totally deaf that I would have the cochlear implant. But he did not tell me specifically like what it would do for me. He just literally said, "We have this that will just help you," without going into detail. So I didn't know too much about it beforehand, and I didn't have anybody really walking me through the expectations. But I think I came in with very low expectations because I'm totally deaf. So if this device helps me to hear the doorbell, because I'm afraid to be at home alone now that I can hear, then I'm all for it. So yeah, I wasn't one of those patients that needed to be sold on it. I figured if I trusted my surgeon, you know.
So without some of that counseling, what was it like then to share this with your family and friends and communicate that you were losing your hearing? What was that like for you, and how did you do it?
Oh, did you ask me that question?
Yeah.
Oh. I'm very close. I have very close friends and family. So they were with me during the early parts of not knowing what was happening to me. So I feel like that I didn't have to really say, "Look, I'm deaf," but I did. It's very difficult to say. I don't think that it was important for me to have them understand that I was deaf. It was important that they would want to include me into the conversation. So I think I can't hear you was used a lot. And I don't think people really understand that you can't hear. Like me saying that, somebody would say, "Oh, me either." It's hard for me too. And they're saying it, but not really respecting that. No, I'm deaf. And as my sister said to me, I have a twin sister who is not deaf. And she said, "You really didn't have to say it because you picked up lip reading very quickly." And I said, "Oh yeah, that's true." So I don't think I don't know exactly how I communicated to my families and friends other than saying, "Look, I'm deaf, I can't hear." And they saw me lose my hearing. So, you know what I'm saying? So I didn't really articulate it, but I do remember going out to dinner with a group of women from my church, going to lunch from my church. And this is when I'm totally deaf. No, nothing. I'm having a hearing aid that's not helping in the good ear. And I remember going to lunch and they were talking in this restaurant and the conversation's going and I'm sitting there and I can't understand what is going, and I just let it all out and I started crying. And the women came around and they said, "What's the matter?" And I just looked at them and I said, "I can't hear." And they just started. They went, "Oh, Lynn." And then I started expressing how I can't even worship in church like I used to. I can't hear the music. How am I gonna worship the Lord? And they just rallied around me and gave me support and said, it's okay, Lynn. But that's the only thing I remember actually saying. I can't hear my husband. Like I said, he went through the steps with me. I mean, we had our ups and downs. So I don't really remember specifically how I communicated that, other than showing them where my need was for them to help me hear.
Yeah.
I know my mother suffers from severe hearing loss. She has Meniere's disease, and it's, her hearing loss has gotten gradually worse. And she started with a lower end hearing aid and moved up to, progressively more higher end hearing aids. She's a very social person like you, Lynn, and she does not like being left out of conversations. So that's always been a challenge. I think that becomes more and more of a challenge for her, because it's harder and harder to continue to ask people to repeat themselves. But she also is like you, someone who looks on the bright side of things and tries to make light of a serious issue. And so very often she would mishear what someone said. And then, when she'd repeat what she thought she heard, and it was just bizarre, whatever it was. and that would be, an opportunity to laugh at it. So
it almost makes me think that we need a universal sign for I can't hear you, so that, a t-shirt is obviously a little too much, but some way for the general public, obviously your friends are going to hopefully hear you and then respond accordingly, but the world needs to know. And without you having every single time to say, speak up, or I can't hear you, like a medical bracelet.
Yeah, I think so much of it too is dependent on the person going through the experience. I know we have a lot of patients who don't really feel comfortable, even with friends or family, expressing the frustrations of their hearing loss, and as a result start to kind of withdraw socially and pull back from activities that they may be used to engage in. And I think that's when we start to see people come in more, is when they notice they're now having to withdraw and, kind of spend more time at home by themselves as a result of the hearing loss. But certainly, I think having a good support system and having understanding family makes going through that process a little bit easier, at least.
Absolutely. So, Dr. Schmiel, I was describing how for my mother, she started with hearing, one type of hearing aid, and had to continue to increase the quality of the hearing aid, because she was not getting the results that she needed out of it. And at some point, she was recommended for a cochlear implant and by her audiologist, but then her ENT said, I am not going to recommend that you get this surgery, because you already have severe balance issues, and I don't want to take the chance that it could worsen those, because she had already fallen, she's elderly, she had already fallen and broken her hip. Can you tell us about the different, it's going to be different for everybody, I know, but kind of the different options for treatment for hearing loss, and how do you decide whether to recommend one over the other?
Sure. So I think the first step in the process really is to get good, solid diagnostic testing to tell us the type of hearing loss, how severe the hearing loss is, and always involving our non-audiology counterparts in the decision-making too. So involving people like ENT. We at Cleveland Clinic are lucky to have vestibular audiologists who will do workups on patients with balance disorders, so we can see, is a cochlear implant the right option for them, or could it make something like their balance worse? So I think getting all of that diagnostic testing under control is the first step to then look at all of our treatment options and see what might be best. Oftentimes, patients with hearing loss are starting with hearing aids, especially if it's progressive in nature and maybe not as significant. But regardless, hearing aids or cochlear implants, we tend to see that the uptake of devices and how many patients we're reaching with devices tends to be pretty low. So I think we still have quite a bit of work to do to get patients the treatment they need. With cochlear implants, once we get to a point where patients have been wearing hearing aids, maybe they're not as successful as they used to be, or they're feeling like they need to upgrade or get new technology to make it more successful. That's when we start thinking about something more like a cochlear implant or a surgical device, when hearing aids, no matter how good they are not giving patients speech understanding, not providing back clarity of sound. And that usually first presents itself when patients are in situations, Lynn, like you mentioned, like background noise. You're at maybe a restaurant with a group of people and you're really struggling to understand. And so with the cochlear implant evaluation, what we'll do is actually test with hearing aids on. So patients get the benefit of, one, knowing are they a cochlear implant candidate, but two, trying out a good set of hearing aids and seeing if that gives them better clarity maybe than what they're using right now. Another really important factor that we're starting to look at more are things like questionnaires and having patients fill out questionnaires about their daily listening situations and how they are experiencing those with the devices they're wearing now. And that can help kind of guide us to decide if, based on their lifestyle, maybe moving to something like a surgical treatment would be the right choice.
And can you just, for the people who don't know what a cochlear implant is, can you describe how it works? Meaning, it is surgically implanted into the skull, and where do the little wires go?
So I'll start with hearing aids, I think, because a lot of people are introduced to hearing aids first. So with the type of hearing loss that I'm talking about most often, which is called sensory neural hearing loss, typically that exists at the level of the organ of hearing or the hearing nerve. And oftentimes hearing aids are the first sort of line of treatment for that. What hearing aids are doing is taking sound and amplifying it to make it louder and then sending it through that same pathway. But oftentimes as hearing loss progresses and becomes more severe, parts of that organ really are just not working the way that they used to. And so sending sound with the hearing aid is kind of like amplifying it with a broken speaker because the organ is still not working the way it used to. So with the cochlear implant, what we're doing is taking a surgical device and implanting it into the organ of hearing, which looks kind of like a small little snail. And that little surgical implant is going to essentially take the place of the parts of the organ that are not working the way that they used to. So that is what the ENT or the surgeon will put into the organ. There's a small part that sits under the hair up here, but it is still on top of the skull bone, so it's not a brain surgery. And then we take an external component and connect it to that internal implant, and it will send the sound as an electrical signal to the hearing nerve and up to the brain. So rather than amplify it, we're just sending it in a new way that allows it to sound clearer and easier to understand by the time it reaches the brain.
Wow. That's fascinating. I loved hearing that. Yeah. So Lynn, what are the results for you with having this implant? What's this been like?
It is a miracle. Because I am totally deaf and the cochlear implant has given me my ears back, even though I only have one at this point. But even with just one ear implanted, I have my life back. And I'm going to tell you, I feel like it was a gift from the Lord because I got implanted December 21st. And it was activated, actually turned on a month later on my birthday. So I felt like it was a true gift. And let me tell you, I am back, even though I'm cyborg Lynn. I call myself cyborg Lynn because like Molly said, you have a magnet under the skin of your skull. So there's an external piece that you take off, but the magnet's always there. So if I go buy something metal, I could stick a soda can on my hand. So I call myself Cyber Lynn, but let me tell you, it's such a gift that I can hear again. When I take it off, I'm totally deaf. I'm still deaf.
Wow.
But it allows me to hear. I'm actually hearing this podcast because it's directly streaming to my implant, and I can hear you. And coming from total silence, deafness, to now being able to hear is truly a miracle. I'm able to go to the movies, even though I still use closed captioning, but I can hear the movie. Back to going to the movies again, back to going to the theater again, back to listening to music and dancing at my daughter's wedding, because I can actually hear parts of the music. Now, one thing about a cochlear implant, I have yet to be able to hear music like I used to, but at least now I can follow the beat a little bit. This is not perfect hearing. So I don't want anybody it's not a fix at all. What it allows, like the first time I got activated, my husband was laughing at me because I was like, is that the turn signal? I can hear the turn signal. Is that the water running? I could hear it, and I didn't realize how much sound I was missing.
Wow.
And it's just such a gift. And I got my quality of life got back again. So I'm still different, but I'm able to live a full life again, and it's not isolating. When you have hearing loss, you withdraw, you become isolated, and this has allowed me to come back as Lynn again. So it's truly a miracle.
Wow.
It really is. The hardest part in this journey is the decision to actually get the cochlear implant. That is the hardest part. The surgery itself is, I guess my surgeon told me, oh, these are now becoming like the new knee replacement surgery. And he said there's really nothing to it. And he's right. Even the recovery and the pain was very minimal. The hardest part was actually making the decision to get it done, because you're so fearful. It's in the brain. You're like going, oh my goodness. And then they tell you about those risks, you're like going, oh. But that was the hardest part. And I'm actually preaching to the choir, because I'm supposed to have my second ear done, and I've been holding off because I've been holding off only because, even though the surgery was fine, recovery was quick, very minimal discomfort, it still was a major operation, and I didn't feel like going through the trauma again.
Yeah.
But I'm actually I saw the doctor, and I'm going to schedule getting my second ear done, because she told me it really helps and will help me hear. But the hardest part in this journey is actually making the decision to go and get it done. A lot of the insurance companies make sure now that you qualify. You got to have a certain score level of not being able to, with word recognition. Molly knows that. So it's that walk of living through your deafness before you get to the cochlear implant, which is the most difficult part of the journey.
Yeah. Yeah. Insurance is a whole nother topic that we probably can't get too much into, but I've heard that insurance doesn't cover hearing aids, but does cover cochlear implants in some situations, which could potentially influence some people in their decision.
Yeah, that sometimes is the case, unfortunately, that hearing aids are not viewed in the same way as a cochlear implant, with it being a surgical device. And so a lot of insurances offer minimal benefit, or you might have to use that benefit at a certain clinic to be able to make use of it. Whereas cochlear implants, we at least can get the insurance to give us an authorization to move forward with a surgery. So it's more likely that we can get that approved than hearing aids. But I love what Lynn said about it taking a while to make the decision to get to a cochlear implant. I think in my experience working with patients, that is very true. It takes a lot of years in some cases for patients to feel ready to take that step. But in so many of those cases, once they have the implant and they've used it for a while, they say, man, I wish I would have done this years ago and not waited so long. So I do think that there's some benefit to maybe taking that step a little sooner than you're comfortable with to really then have more years of optimizing that hearing and listening more with the implant. So I wanted to comment for a second on the surgery. I know that's something oftentimes patients do worry about and are fearful of. In most cases nowadays, this is an outpatient procedure where patients get to come in the morning and then go home the same day. And there are even some clinics in the US now that are doing these under local anesthesia, so you can be kind of partially awake during the surgery. So I think we are advancing the field in that direction to make it more accessible for more people.
Wow.
I have a question, Lynn, or actually both of you maybe. When you get your left ear done, Lynn, will that also help with balance issues, or is that more of an eye thing?
No, well, I think Molly would be able to answer that question better, but I was told by my ENT my balance is shot. So that was not an issue for me because I don't have balance anyway. I'm almost near zero, I think, in my balance issue. From what I understand, people can, it does affect your balance. And some people bounce back, and some people, it could be a permanent thing. But for me, it's not going to be an issue because I'm already at no balance.
Got it.
Yeah, I think in some cases, I don't know that it helps from like a functional vestibular perspective, but from the perspective of I'm only getting input to one side, everything sounds like it's coming to just the one ear where I have the cochlear implant. I think when patients get a second one, they feel that in their environment and in space, they might feel a little bit more balanced because now you're getting sound to both ears, which oftentimes helps with things like localizing sound or telling where it's coming from in space. And listening in background noise is another area where we see having two implants can really have benefit over just one.
Oh, cool. Interesting.
So I wanted to jump onto a topic that's related to hearing loss, which is tinnitus. You know, I know that that tinnitus is related to hearing loss. Tinnitus, hearing loss is a cause of tinnitus. Can you talk a little bit about what that connection is? Why people with hearing loss? Do all people with hearing loss have tinnitus? I know that's a whole different topic. We're not here to talk about all the treatments for tinnitus, but why does that happen?
Yeah, so not every patient with hearing loss has tinnitus, and not every patient who has tinnitus has hearing loss. So the two can exist separately. And one of the challenges with tinnitus is there are so many causes for it. Things like exposure to noise, certain medications, certain dietary items, stress. So it can be hard for us to pinpoint what causes it for each patient. But in many cases, hearing loss is sort of the preceding factor that then tinnitus appears. And then maybe patients didn't even realize they had some hearing loss, and we identify that because they come in for their tinnitus. So sometimes it can be like the chicken and the egg a little bit. But with tinnitus and hearing loss, one of the thoughts behind that is your brain with hearing loss is now missing access to sound that it had before. And your brain is seeking sound and seeking stimulation. And so it sort of creates its own sound in place of those pitches that you used to hear normally and now have hearing loss. I always tell patients, I know it's not something you wanted your brain to do, but it does it anyway so that you have something to listen to. A lot of patients will say when they're in silence, so like right before bedtime is a big one, that the tinnitus sounds louder. And that's because your brain now is not paying attention to anything else and focuses more on that tinnitus. I often give patients the analogy that it's best to be surrounded by sound. Like if you were in a dark room and then someone lights a candle, it looks very bright. But when you turn the lights on, that candle doesn't look as bright anymore. So maintaining an environment that has a lot of sound, even if before bed it's something like a fan or the TV, that will keep your brain a little more distracted. So you pay more attention to the other sound and less to the tinnitus. But once we get to the point where patients have more significant hearing loss, things like hearing aids and cochlear implants often help to reduce how bothersome the tinnitus is or reduce how much the patient perceives it. In many cases, it doesn't actually treat it. There's no pill we can take to get rid of it, and it doesn't make it go away permanently, but it can at least help make it less bothersome. So Lynn, I'd be curious to know, did your cochlear implant help with the sound in your ear?
The tinnitus is the monster that I have to live with. Unfortunately, I have it in both ears. Before my cochlear implant surgery, it was very loud. It was disturbing my sleep. But after the surgery, maybe about a week or two after it quieted in my implanted ear. Even now I'm hearing it, which makes me talk loud because I'm trying to overcompensate the roar that I'm hearing. So I would, in the long run, the cochlear implant seemed to quiet the tinnitus. It's still there, but it's not as loud in my right ear as it was prior to the implantation.
Yeah, that seems to be the common experience, that if we can give your brain back sound in some way, it at least will pay more attention to those sounds coming through the implant than to the tinnitus.
But when I take off the implant, it's back, but when the implant's on, it's quiet. But now I get it from this side.
So Molly,
it is annoying, and if I pay attention to it, I would go crazy. But I think my brain has learned to ignore it.
Yeah. Molly, did you say that hearing aids also have the same effect, where the noise of the room is louder, so the tinnitus seems quieter?
Yeah, they can. And one nice thing about hearing aids that doesn't necessarily exist with cochlear implants yet is a lot of hearing aids have the capability for us to turn on something called like a tinnitus masker or a tinnitus sound generator, where your hearing aid can amplify sound and give you back better sound, but simultaneously be playing some type of like a white noise that can slightly mask out the tinnitus. So a lot of hearing aids now have the technology where we can have that, so someone could turn on that tinnitus sound if it's really bothersome to them, to help further kind of mask it out or reduce how bothersome it is.
Interesting.
Otherwise, you fill that in with sound in your environment. Like my husband has severe tinnitus, and when it's hardest for him when we're hiking in nature because there's less sound. So normally when we stop for lunch, for example, we try to do it by a creek, and that is his white noise.
Yeah, exactly.
So Lynn, you are such an amazing advocate for this entire community and beyond, I'm sure. And I always feel so lit up when I hear you. And I imagine you have some words of wisdom for anybody that's struggling with this, feeling not understood or feeling like they can't understand. What would you say to a friend or a loved one who's dealing with this?
I have a lot to say. Number one, be patient. Be patient with not only yourself, but also other people. But more importantly, make sure that you take care of your soul. You have to make sure that you are grounded and connected spiritually, so that you can sit in the silence and let nature, God speak to you in that silence, in the deafness. Don't be afraid to sit in the silence. Take care of your soul so that it doesn't matter if they understand your hearing loss. It doesn't matter that you're not hearing all the conversation, because you're going to be grounded in where you are. And you should be in a place where you can accept the silence. It's okay. It's not a death sentence. It's okay to sit in the silence. Find the things, the people that are in the hearing loss community. I reached out to HLAA when I was very anxious and fearful of losing my hearing. And because I connected with people who were living with their hearing loss, I found accommodations, closed captioning, even different types of closed captioning phones, so that I can hear things when I'm home alone. I got the fire department to come in to put smoke detectors in so that they can wake me, because these were the things that I was sitting in fear of being deaf, of not being able to hear my friends, my family. But I also wanted to have a quality of life. So I began to search and ask questions from people who were deaf. So the deaf community, I am very close, just like I went with VeDA. I'm also a part of the HLAA chapter. So I began to ask questions and find things that help me to maintain my quality of life. And don't be afraid of the cochlear implant. I'm telling you, it is God's miracle. It has given me my sound back. So I would just say to anyone who's struggling, especially at the beginning of this hearing loss journey, be grounded. Make sure you take care of your soul and connect to your higher power, connect to nature, because that's when you're going to find out and kind of accept where you are in this so that you can move forward.
Lynn, you're such an inspiration. And I do think that it makes a big difference to hear from people like you about what your experience is, to take the fear away. And I'm so excited that you and Darcy started the support group for vestibular patients with hearing loss, because I think that that is one part of the vestibular experience that is unique, and you don't get it until you get it, so to speak. So I'm so glad that you're there to provide that support for others. Thank you.
You're welcome.
Dr. Schmiel, we all hear about revolutionary research that is restoring, that will someday, we think, restore hearing. How far is that from becoming a reality?
Good question. I wish I knew the answer to this in a more concrete way. It's something I have patients ask me about all the time. I have patients ask, should I not get a cochlear implant so I can, kind of save my ear for some therapy in the future? My understanding from the current research is that we're still quite a ways away from this, years, surely. I think there are, some studies that go on with animals. There are even a couple of clinical trials available now, depending on what causes the hearing loss. So, for example, if someone has a hearing loss that's caused from a certain genetic mutation or genetic etiology, there are going to be clinical trials coming up where they're going to try things like gene replacement therapy. I know there's studies looking at things like regenerating those hair cells. But again, I think we're so early in that space. There's a lot of investment into research and different companies that are looking at this. So I do anticipate it's going to kind of take off in the next couple of years, but it takes a long time to get through things like research studies and clinical trials. So I would bet we are still many years away from that being widely available in a clinical space, at least.
They certainly like to put them in movies. These ideas are very science fiction still, but who knows? Maybe closer to us than we can imagine.
Yeah.
I was just watching an old episode of The Bionic Woman. The bionic ear. Do you guys remember that? Where she goes like this, and then there's that hear that noise. Zzz, 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 zzz.
Yeah. I often tell my patients, at least right now, who are seeking cochlear implants, I wouldn't probably wait or, kind of hold on to that hope for too long, because one factor that in research over time has helped us to better understand outcomes with cochlear implants is the length of deafness or the duration of hearing loss that someone has before seeking a cochlear implant. Generally speaking, the longer the period of hearing loss, the harder it can be to adjust to a cochlear implant and to get the same outcome. And so I tell patients that I can't say if the same will be true for things like regenerating hair cells, that if you've had the hearing loss a long time, it might be hard to do because the research just isn't there. But I think we're still far enough away that I usually tell people I wouldn't hold out too long and waiting for something like that versus getting an implant right now.
Yeah.
Well, the good news is that while there isn't a cure, there are treatment options that are very effective, as we've heard from Lynn. Miraculous even.
Yeah.
So if there are people out there who are frustrated about their hearing loss, know that there is hope. There are people out there who understand, peers who you can talk to that can give you tips and tools, tips that have worked for them, and hearing healthcare professionals like you, Dr. Schmiel, audiologists who can help you figure out what is going on and direct you to the appropriate treatment. So as always, seek care from your healthcare professionals, and if you need referrals, I would say that probably your primary care doctor is the person to talk to first.
Yeah. And I think, support groups, things like that, they're all over the internet too. If you don't have anybody locally that that you can talk to about these things. I think one of my biggest take home messages, if someone thinks they're a candidate for hearing aids or a candidate for cochlear implants, is that just being evaluated for it or just talking to your audiologist about it does not commit you to moving forward with treatment if you don't feel like you're ready. People feel hesitant to come in for the cochlear implant evaluation where we determine if they're a candidate, but it is completely elective. We are not going to force you to do anything. So just being evaluated to learn about your options, I think, gives you the information you need to then make a decision that's best for you.
Lynn, is your support group open and available to anyone?
Yes, anyone, even if you don't have hearing loss, it's open for anyone to join. Every second Thursday of the month we meet.
Awesome.
Great.
Information on VeDA's website, vestibular.org, or just contact VeDA and we will get you connected with Lynn's support group or one of the many other online support groups that we have. Well,
Thank
Lynn,
you, everyone. This is such a lovely conversation, and I learned a lot. Yeah.
We always learn a lot from our experts, both patients and healthcare professionals. Thank you for sharing your experience with us today.
Yeah, thank you for having us.
All right.
Yes, thank you.
Good night.
Good night.
Thanks for tuning in to ICU this month.
We hope this conversation sparked new understanding of the vestibular journey. And for all of our patients out there, leaves you feeling just a little more heard and a little more seen. I see you.